Ang dami na pong questions para po sa kondisyon na stroke. Pero una, gusto ko lang pong sabihin na batiin po natin ang founder ng Stroke Society of the Philippines.
Hello, Dr. Kwanang. I'm here with Nina. How are you? Good morning.
Yan si Dr. Kwanang, nakita ko siya last Sunday lang dyan sa Pinto Museum. Siya pala ang founder ng Stroke Society of the Philippines. 80 plus na si Doc eh. Oh, yes, pero still.
Age is a secret. Yeah.
Pero
But he's
still.
very, very sharp.
He's still very sharp. Ganun pala pag neurologist siguro.
Talagang sharp ang mind.
Yes. Kaya
And
yan
with all
po.
the arts around him.
Of course, sabi nga niya, ang art daw ay healing. It's a healing.
It's a form of healing.
Yes, art
mental
heals.
health.
Yes,
Kaya
mental
ganun ka-sharp si
health.
Dr. Kwanang.
Oo nga. Uy, yan, pag-usapan natin kasi isa sa mga choices, iwas stress. Well, doktora, para po muna sa lahat, ano ba ang stroke?
A stroke is actually a brain problem, hindi po siya heart problem. Okay, it's a form of, it's a vascular issue, whether na bumara po yung kanyang artery or vein or pumutok. So, depende po sa area ng utak kung saan po bumara o kung saan po puputok, at yan po ay magmamanifest ng signs and symptoms. Pag pumutok po yung ugat or bumara, syempre mawawala ng daloy ng dugo. Ang dugo po yung carrier ng ating oxygen and nutrition, especially glucose. So pag nawalan po ng oxygen and glucose yung area ng utak, yung brain cells po ay eventually mamamatay.
So yun po yung bigla na lang, yung bigla na lang natutumba, nawawala ng malay.
Yan ay medyo maraming meaning. It doesn't mean to say na pag nagkakaroon ng loss of consciousness, it's automatically a stroke. Kasi pwede lang po siyang fainting spell, loss of consciousness. It can mean a lot of things. Pwede pong hypoglycemia, bumaba lang po yung sugar niya, or may problema sa puso. Pero kapag may kasamang sakit ng ulo, bago po siya nawalan ng malay, ayan po yung delikado.
Most likely, opo.
Most likely, may pumutok na ugat na po yan.
Opo. Doc,
Yung ba yung aneurysm?
Pwedeng aneurysm.
isa rin yun, di ba?
Pwede isa
Nakatakot
din
yun,
po yan sa
Opo,
mga
opo.
kinds of stroke.
Opo.
Kinds of stroke.
There are
Opo.
several kinds of stroke.
Dr. Tina, isa po sa mga karaniwan na ating mga binabantayan is yung blood pressure, di ba po? Of course, indicator lang naman po ito, di ba? Pero yun po ba ang direct na correlation nun? Sabihin natin kapag medyo mataas-taas ang iyong BP, you are most likely na at risk para po magka-stroke. Tama po ba yun?
Yes, of course. Actually, hypertension is the number one risk factor for stroke.
Yes.
Sa Pilipinas, it comprises about more than 60% of stroke patients are hypertensive.
Ayun na nga.
Oo. So, yan yung pinaka-common. That is because of
po ulit?
60.
more than 60%.
More than 60%.
67 to be exact.
Almost
Wow.
70 na
Yeah.
pagka, di ba?
Oo.
Round off
So, very,
yan, ano?
very common. Yan.
Opo.
Napakataas. Kaya it's important na it's not just knowing that you are hypertensive. You have to be compliant. Dapat umiinom po ng gamot. And dapat monitor yung blood pressure. You have to know regularly, you have to monitor your BP for you to know kung controlled pa ba yung blood pressure mo.
Pero
Yung
Doc,
iba,
paano
they might
yan?
not even know na meron silang high blood.
Or
Ayun
ayaw
din.
nang alamin.
O yung
Di
iba
ba,
ayaw
Doc?
na since wala daw
Oo.
sintomas.
Opo.
Yun po yung delikado kasi not knowing is dangerous, especially when you're getting older. And then I'm sure you're all aware the manner of eating, how much you're eating, the kind of food that you eat, and plus the fact all other vices that
Oo.
involve, especially in our younger population. Yung lifestyle natin, hindi na masyadong natutulog ng maayos, hindi na po nag-exercise masyado, meron pang mga sigarilyo or vaping involved, umiinom pa po ng alak, at hindi po nagko-control ng ating food and exercises, then more likely you have to check your blood pressure. Doesn't mean to say that you don't feel that you feel okay and that means you're okay.
Opo. Doc, Tina, nakwento niyo po sa akin kanina sa makeup room. Tinanong ko kasi kung pang ilang leading cause of death itong stroke. Nasabi niyo po at number 3. Pero hindi ibig sabihin nun na bumaba. Dati kasi number 2.
Tama.
Pero hindi kasi ibig sabihin nun bumaba. Pero bakit po siya bumaba at number 2?
It only means to say na marami na po ngayon namamatay due to cancer.
Umangat siya ngayon.
Oo, umangat yung cancer. Oo, but if you look at the raw data, the numbers, in terms of deaths from stroke, it's still the same.
So, number 1 is heart.
Heart attack.
Number 2,
Cancer.
naungusan ng cancer ang stroke, but still, top 3.
Nandun pa rin yung
Opo.
stroke.
Sabi ko nga, if kung hindi, parang usually ang mga Pilipino may kakilala or kung hindi mo kamag-anak or
May
hindi
nakita
ikaw
ka.
mismo, di ba, nag-mild stroke or stroke. Ngayon, doktora, sabi nyo, aneurysm isa sa mga klase ng stroke. Ano po yung mga iba pa at ang mga common na types of stroke and sintomas po?
Okay, there are 2 major kinds of stroke. Ischemia and hemorrhagic. So ischemia means bumara, blockage of an artery or vein. While sa hemorrhagic, there are several kinds. Yung one is aneurysm, rupture of an aneurysm. Pangalawa is what we call as hypertensive bleed. So ang difference between the two is the location of where the hemorrhage is located. Like sa barak, in aneurysm, rupture of an aneurysm, nasa layers po siya ng utak kumakalat. And that is what we call as subarachnoid hemorrhage. While yung sa hypertensive bleed or hypertensive hemorrhage, nasa parenchyma po siya ng utak. Meaning to say, parang nasa laman na mismo siya ng brain. So, iba-ibang causes, no? Like commonly, kapag nasa laman po ng utak or nasa parenchyma po, most common cause is uncontrolled hypertension. Whereas yung sa kabila naman po, yung ruptured aneurysm, there are several factors. Number 1, familial. Kung meron pong family history of aneurysm, especially first-degree relatives, then more likely if you have 2 of your first-degree relatives na may aneurysm, then it's best na magpa-screening na po tayo by doing angiogram, CT angiogram, or MR angiograms. Swerte na po tayo mga generation natin kasi we can tell if you have aneurysms. We don't have to wait for it to rupture kasi it won't be manifesting symptoms if it's
Opo.
unruptured. It will
Biglaan
only, bigla. Correct.
Usually yung aneurysm, sorry po deadly. Pag biglaan siyang namatay. Yung ganun
Yeah,
po.
correct.
Opo,
Oo.
opo.
So,
So malalaman mo na, Doc, paano po? Paano mo na ngayon malalaman if at risk ka na for aneurysm?
So you can tell, you can undergo CT angiogram or MR angiogram.
Wait, angiogram, ibig sabihin may ipapasok, di ba? Instrumento
Iba naman
ba yan
yun.
or
That's a
something?
digital subtraction angiography.
Okay.
Yun yung invasive way. So,
Opo.
yung picture-picture lang, nilalagay
Ito
ka sa
picture-picture
machine.
MRI.
lang. Sa MRI.
MRI. There's another modality there that we can do. It will take a picture of your blood vessels. That's angiography. So that will give you an idea. We'll take a picture of your blood vessels and you can see from there if you have an aneurysm.
So ano yung sasabihin ng blood vessels kapag may nakita? Makapal-kapal?
There's an outpouching. It looks like a balloon. So it means a lot of things. It doesn't
Opo.
mean to say that
Agad-agad.
meron akong aneurysm. Ay, nakakatakot na. Baka mamamatay ako eventually. Hindi naman gano'n, no? It all depends on the size of the aneurysm, the location of the aneurysm.
Opo.
Okay? And plus other risk factors for rupture. So it has to be provoked before it ruptures.
Like,
How?
anong ibig sabihin?
So,
High stress.
ang mga provoking factors, number 1, uncontrolled hypertension pa rin.
Ay, naku talaga yung mga high blood.
Okay.
Naku
Okay.
po.
Other
Oo.
provoking factors will be smoking.
Okay.
Smoking,
Kasama
and
na
then
vape.
you're alcoholic. Then you have all the ingredients to provoke your aneurysm. So that is where patient would feel sudden onset of headache and the worst headache of your life.
Yes.
Ay, naku, yun, we always hear that,
Oo. Ang worst headache.
of your life. Yung iba, they have it, kala nila migraine lang. Paano mo ma-differentiate po yun? Kasi yung iba nung una, malagi kasing masakit ang ulo niya dati, kaya siya nagka-aneurysm. Minsan naririnig po natin yung mga ganong kwento.
May specific na characteristic kasi for us to say that it's just a plainly migraine headache. So if you have like the usual, that we call it, as the usual headache that you have been experiencing in your whole life, and then suddenly nag-change yung character niya, that's a danger sign.
Yung parang dun mo lang siya
Kakaiba.
naramdaman.
So it's the parang, marami naman, lagi naman headache ko, like tension headache, for example, squeezing in character, or pulsating type, but it's usually like that, di ba? Then it's something that is not quite dangerous. But suddenly, if you felt na yung from a pulsating type of headache, biglang naging generalized and very, very painful, and it's associated with vomiting, and then you're always feeling sleepy, then those are danger signs.
Laging inaantok?
Oo,
Tsaka
danger
nagsusuka.
signs. Vomiting,
Okay.
drowsiness, change in the character of headache, then you must consult a neurologist right away.
Pag sinabing change in the character of a
The
headache, nag-iba yung
kakaiba sa
usual
usual.
na
Opo.
headache mo.
Sabihin po natin, Doc, sabihin natin at risk ka. Sabihin natin, case study at risk ka.
High
Isang
blood.
pasyente, high blood, o sabihin natin, meron nakita, huwag naman sana. Paano kung pa rin siya maiiwasan? Ano pa rin ang mga pwede kong gawin para hindi mangyari yun?
Okay, so of course you have to check if you do have aneurysm or not. Then if you, for example, unfortunately, meron pa tayong aneurysm, then you have to check a neurologist or a neurosurgeon for us to evaluate if your aneurysm has high risk for rupture. Kasi we can tell based on what we know as natural history, that is on the basis of size, location of the aneurysm, the configuration, anatomical architecture of the aneurysm, and then all other factors or profile of the patient. Then it will give you a certain percentage of risk in a year or in 5 years' time. Then, if for example, high risk ka talaga, then we can do either coiling, no? Marami ng paraan to prevent it from rupture. We will refer you to our friends, mga friends namin na neurovascular surgeon. Oo.
Lifestyle-wise, Doc, lifestyle-wise. Sabihin
Okay.
natin, wala pa ako dun sa stage na yun na, di ba, para yung intervention na yun. Ano magagawa ko sa practical na mga paraan?
So, for example, hindi ka naman high risk, di ba? Like, maliit lang. Then we will tell you not to stop smoking if you're smoking. Okay, if you love drinking alcoholic beverages, make it very minimal, like occasionally rather than drinking every day. And it depends also on the amount that you drink. And of course, control your hypertension if you do have hypertension.
So, okay lang naman maggamot, di ba, Doc? Okay lang naman
Oo,
maggamot.
merong
Of course,
maintenance yan.
yes,
Eh, kasi-
and that is advisable.
Eh, di-
Baka
kasi
yung iba
maraming
ayaw
ayaw
mag-maintenance. Kasi isipin, usually we hear this from our cardiologists pag nakita nila, ay hindi na ako high blood, ay stop ko na yung maintenance ko.
Oo.
O tapos biglang na high blood.
Yeah, we encounter that a lot.
Opo.
That's very, I'm thankful that you
Yan.
raised that up.
Opo,
Oo.
opo.
It doesn't mean to say na even if you are taking medications and then controlled na yung BP natin, then ihinto mo na. It only means to say na yung gamot mo ay yun ay nakakatulong sa pag-control ng BP. Then wag mo siya ihinto kasi once you stop it, eventually, tataas siyang bigla and then pug, stroke na siya.
Yun.
Ayaw po natin mangyari. Dok, talaga naman, pwede bang bumalik kayo? Dahil, oh my gosh.
Marami-rami pa tayong pwede
text.
mapag-usapan.
Oo, kasi ang dami po ang may questions about their, ito nga, hindi ko na nga sa dami. Ito, si Ben Francis, sabi niya, my mom passed away in 2014 dahil daw sa stroke. I'm sorry to hear this. Ben, sabi niya, kaya ang sagot niya dun sa question of the day, all of the above, ang emphasis daw ay physical movement. Happy Monday. So, Doktora, yung movement, ano po ang inyong masasabi dyan na kailangan gumalaw-galaw raw, mag-exercise aside from, tamang pagkain?
Exercise, ang key doon ay regularity. Hindi yung intensity.
Yung bigla.
Okay, yung bigla-bigla. Nag-exercise ka naman, pero once a week lang, di ba prone to high blood pressure yan, biglang tataas yung BP mo, di ba? So the key there is kahit na nag-walking, a simple walking will do, for as long as you do that, like 30 minutes every day, that will definitely help a lot.
Ayan.
Ayan.
So, sabi ni